Why do we get visual fields? The most common reason we get visual fields are on patients who have glaucoma. It's not measuring their peripheral vision. We're measuring their central, in most cases, we're measuring the central 24 degrees of vision. That's what a Humphrey visual field 24-2 is. We're measuring the central 24 degrees. We're asking the patient to fixate at a point straight ahead, and as they're fixating at that point with one eye, we're measuring lights of different intensities at multiple points in their visual field. We are trying to detect if there's any areas of decreased sensitivity in their visual field. They may not necessarily have a blind spot, they may still be able to see in that spot, but they may have less sensitivity, and that in and of itself is part of glaucoma, and that can be early glaucoma. So people will develop less sensitivity in one point of their visual field before it becomes a blind spot. And that's what essentially that computerized test and the algorithm is looking for, is trying to figure out what the sensitivity of each point in their visual field is. So it's important when you do that test, we obviously check one eye at a time. It's important the patient's comfortable, is paying attention. As far as the different kinds of visual fields, the most common that we order is a 24-2. And there are different algorithms. There's a 24-2 C to standard, a 24-2 C to fast, and a 24-2 C to faster. And they have different algorithms looking for different things and different speeds. But essentially, you're testing the central 24 degrees of vision. Sometimes we'll order a 10-2. So if a 24-2 is testing the central 24 degrees of vision, then a 10-2 is testing the central 10 degrees of vision. So you're honing in right on just the very center of the vision in each eye. And that can be of consequence in some patients who have glaucoma, where most of their visual field defects are very close to the center of their vision, or it may be important for other macular pathology. So a 24-2 measures the 24 degrees of vision, a 10-2 measures the central 10 degrees of vision. And then those are the two main types of field that we get. You may also see that sometimes we'll order a stimulus 5 visual field. The 10-2 and the 24-2, the most common stimulus size we use is stimulus 3. And some patients who may have low vision will use a stimulus 5. All that means is we're using a larger spot to test their vision. So if someone has compromised vision for whatever reason, and we still want to get an idea of what their visual field looks like to see if there's any focal defects, then we will order a stimulus 5 visual field, which is just a much larger spot size. And then the test works by altering the intensity or the brightness of that spot. So today we talked about visual fields, what they're used for, what the indication is, and we talked about 24-2 visual fields and 10-2 visual fields. And we talked about when we sometimes order a stimulus 5 visual field. So it's really important before you start doing the visual field that you select which type of field, the correct type of field the doctor ordered. And even more important than that is select the laterality. Make sure that if you're testing the right eye, you choose the right eye. If you're testing the left eye, choose the left eye, because the algorithm will be different for each eye. You cannot, of course, use the left eye as a right eye because the algorithm is completely different in terms of where it tests for the blind spot and sensitivity of each point in the database that it compares to. So laterality is very important when it comes to doing testing for visual fields.